Hi everyone, it's Jason Bradley from BodyWorx Physio. Here today to go through with you some dry needling of the ITB and the lateral quad. So the ITB or the iliotibial band and your lateral quad can often get tight and cause some problems such as patellofemoral pain, some bursitis and tendinitis down through the knee here. So common problem with runners, cyclists, anybody that's staying active and using their knees. The problem we have is, and also with post-op, so things like ACL repairs and that. The problem we have with that is after you've had trauma or issues with the knee, this outside portion stays really nice and tight, but our inside portion, our VMO, actually gets inhibited by pain or swelling in through the knee. So sometimes it's the actual problem. So with patellofemoral syndromes, we find that it's actually a combination of the tightness in the ITB and the weakness on the inside that starts it. Sometimes in other cases where we've had surgery or something done on the knee, the actual swelling and that in here inhibits the VMOs, so we're trying to work on balancing this out. So the reason we do dry needling is we want to try and get those muscles to relax out. So dry needling works in a few ways. Now I'm just applying some aqueum to my hands. This is a clean procedure, so we always make sure that we're nice and clean with our hands and the body part is clean. We never want to, whenever we see patients that come in, if they've been on a work site or they're sweaty and dirty after playing sport or something, we always have to make sure we clean the area first. So what I'm going to do with my model here today is we're going to needle in through his lateral quad and his ITB area. So when we pop a needle into an area, it has a few little effects. So when we're looking at the perspective of dry needling, when we pop a needle in, it opens up the blood vessels or vasodilates around the area. We'll also likely get a little twitch in the muscle, which you may even be able to see on the camera. That's the muscle fibers contracting around the needle, and afterwards it relaxes out really nicely. Other effects can also include, it irritates the localized immune system. So we can get a histamine release in that area that stimulates healing. So that's not so much for this area, but if we're dealing with something like a chronic tendon injury, like in the knee or in the elbow, it can be really useful for that area. There's also some other effects that are harder to physically see, but we think it may have an effect on the amount of pain people perceive in that area through some pain gating mechanisms. I've basically focused on those first three because we can really see evidence of those when we're doing the needling. So we're going to start off with coming down through the lateral border of the quad here. I usually start up fairly high. We're going to come in, just nice and gently tap it in. And what I'm doing at the moment is I'm just gently moving it in and out to stimulate that muscle area. My model isn't pulling too many bad faces at the moment, so I mustn't have hit the right spot yet. So we're going to come down a little bit more. As we come down, when we treat with the patients, we feel to see where we can feel tightness in the muscle. And then gently apply that next needle. It's a little bit of a tight spot there. Now I'm going to come down through the band. So in anatomy textbooks, you'll see the ITB is this really nice definite band that comes down through the side and attaches into the side of the knee. In real life, when you study anatomy in uni and they dissect the cadavers or the dead bodies that get donated to the uni, you can see that the ITB is actually thickened through here, and then the fascia attaches into your lateral quad and your lateral hamstring. So we're needling down through this thickened portion of it, but it also attaches into those other muscles. Sorry, please excuse my thumb. I took a bit chunk out of myself kayaking on the weekend. So we're going down through the side here. Oh, he's pulling funny faces, so I know I've got a good one here. He's starting to groan. He actually asked for his face not to be in this clip just so you couldn't see the expressions he was going to pull. It's actually not that painful, it's just usually surprising for people. And then we're going down here to this lower one. The lower one is usually the worst one because there's a higher amount of nerve endings down around this part of the band. And he's smiling excellently at the moment. Now, I'm just going to move my hand. If you can focus on this bit here, I'm just going to see if I can get it to do it. There we go. It's not quite as obvious on the camera, but you can feel it underneath your fingertips, that you can feel that muscle twitching through there under the needle. So when we usually do it applied in the clinic, you can do a variety of treatments with dry needling. You can do active dry needling, which is just stimulating that trigger point and then pop it straight out, go to another area, or passive, where you just pop them in and leave them. I usually do a combination where we pop them in, stimulate each one, and then leave them, and then come back in a minute or so and stimulate that one again. In our clinics at BodyWorx, we always modify the technique though to each patient, because some people are a little bit more sensitive to the needling and may have a bigger after effect or a bit of soreness afterwards. So we always, if it's your first time ever having dry needling, make sure you let us know, because that way we can go a little bit gentler with the technique. Your physio will always explain to you the dangers and issues with needling in any particular area. And we should also explain that you can sometimes be a little bit stiff or sore in that area afterwards, the same as if you'd done a heavy workout or had a heavy massage in that area. We also like to, after we've done the needling, combine that with a bit of soft tissue work on that area or massage, which helps just reduce that post-needling soreness. So that's how we would look at doing some needling on the lateral quad and the ITB for knee problems or even hip problems, such as your trochanteric bursitis. If you've got any hip or knee problems or any questions, please give us a call on 4952 7033 or jump onto the website and you can book an appointment online easy in 2 minutes. Thanks and have a great day.